we talk about generations, and let's talk about like our culture versus the white delegation culture. Why has there always been such a pushback from our culture when it comes to being vulnerable, sharing your thoughts, speaking with somebody unbiased about the things you deal with, versus the white delegation culture? They preach it, they push it, they encourage their children, their friends, their family to seek help. Why has it always been a pushback with our culture?
So that's a great question. And for me, so I've seen both ends of it. In my private practice, my population is mostly white. And in my previous experience, my population was Black and Hispanic.
Mm-hmm.
So I've seen that, right, from both ends, and it's socioeconomic status.
Okay.
You know, it has a great deal to do with the fact that this system is not always set up for us to win. And by that I mean there are just multiple barriers to receiving access. If you think about that, I can answer your question with just it aligns very much so with the healthcare crisis as well. Why don't we go to the doctor as much? You know, is there access? You know, the mistrust of all medical professionals because of our history, right? And
Yeah.
we take it way back to slavery and all the things we've learned. We've learned to hold things in. We've learned to have secrecy and silence. A lot of people scared that they're gonna get their kids taken away from them. Something is going to happen. If I seek out professional help, I am going to be vilified, and my life is going to be disrupted in some kind of way. Also, I don't have time for my life to be disrupted because I work a lot. I do this, I do that. Now, the mindset, you know, I think we also have to deconstruct our mental state as well. Like, you know, strong Black woman trope, I don't like it. I personally don't like it because strength has been misconstrued as grin and bear it, just do it on your own without seeking that support. And a lot of times for African Americans, we as Black people, you know, we've had the church to go to, but we haven't had enough of the education that, okay, you can go to your pastor. Your pastor should say, okay, you got something deeper going on. I need you to go to this service. So I don't know how much that, if that's going to be our first line of defense, then the second line has to be clinical support. Right. I don't know how much of that has been made clear, right, in our community, that these services are there. But I really do believe that in certain communities, it's like any kind of service, we'll take it, but you cannot trust them because they're gonna take your kids. Like you're gonna get in trouble. Something is going to happen, or they're going to harm us. I don't want my kids to be put on medication, so we're not gonna go see no doctor. We're not crazy.
Right.
You don't have to be crazy to get therapy, right? Like it just be an adjustment thing. Like people don't even go to therapy to work through their grief, and we lose a lot of kids. We lose a lot of loved ones, and we don't get support with grief. So I think it's just a miscommunication, a misunderstanding, and also a lot of mistrust with the community, with the healthcare community. I know though many communities have a lot of people willing to do the work and are trying, until we're able to revert that mindset of like, I'm strong, I'm just gonna grin and bear it. Like this is a sign of weakness. I honestly don't know where the sign of weakness came from, like where that who told us that. But I am here to say that no, it is not. Seeking help is a sign of strength. You can only lean on yourself for so long. That only works for so long. And you can only lean on the people in your life for so long. And I think a lot of relational breakdown within the Black community, like why we really get at each other, is because we got two unhealed, traumatized people or groups of people trying to be each other's strength. You don't have fuel for that. If you don't have the fuel for yourself, you don't have it to give to another person. And you don't have the tools, right? And so then we see a lot of damage in that way. We just hurt people trying to help each other. It just doesn't always pan out. So then those are evidence to us in our brains that says, okay, see, I can't trust nobody with my stuff. Keep it to myself. Keep it to myself. Can't trust my doctor. Keep it to myself.